Okay, this is also a hodgepodge of topics. We'll talk a little bit about mass casualty incidents and some other operational things that you need to be aware of. So I want you to review the protocols on this. We use Start Triage to do our primary triage, and primary triage is what we do when we first encounter patients. So remember from the refreshers, first thing we say is if you can get up and move, go over there. Those patients are categorized green. We then go and individually assess the patient. If their respiratory rate is greater than 30, they're red. If they're not breathing initially, we can reposition the airway. If they start breathing at that point, they're red. If they don't start breathing, they're black. If they don't have a pulse at the wrist, they're red. If they don't follow commands, like tell me your name or lift up your hand, they're red. So everyone else is yellow. So basically, get up and move. They're laying on the ground. You check them. Respiratory rate is less than 30. They have a pulse at their wrist, and you say lift your hand. They lift their hand. They're yellow. You say get up and move. They don't move. Respiratory rate's greater than 30. They're red. You're done. Go over. They're not breathing. You open the airway. They start breathing. They're red. You're done. You go over. They're not breathing. You open the airway. They don't start breathing. They're black. You're done. You go over, they're breathing, respiratory rate is less than 30, they don't have a pulse at the wrist, they're red, you're done. You go over, they're breathing, their respiratory rate is less than 30, they do have a pulse at the wrist, you say, give me a thumbs up, they don't follow your commands, they're red, you're done. And again, you say, get up and move, they don't move, you check their respiratory rate, it's less than 30, they have a pulse at their wrist, they follow commands, they are yellow. Once we collect all the patients in a collection point, they'll get what's called secondary triage. This will probably be done by EMS, but may be done by you as patrollers. Typically, this is where the medical control physician, if there's one on scene, will be in secondary triage. There we do a little bit more detailed assessment. We look for people with immediate life and limb threats that require an ambulance. Those are our reds, so we can up-categorize or down-categorize people during secondary triage. If they don't have an immediate life or limb threat, but eventually will need an ambulance transport, they're yellow. If they have minor conditions and probably won't need an ambulance transport, they're green. And if they're dead or they're in the process of dying and we don't have enough resources, they're black. If they are in the process of dying, but we have gotten rid of all the red and yellow patients, or at least all the red patients, we might consider transporting a black patient to the emergency department above a yellow patient, simply because maybe there are resources to care for them. Patients who have decision-making capacity can refuse care. What do we need to do? We need to make sure they are alert and oriented. They are appropriately interactive with us. They understand what could go wrong, which means you need to tell them, I think your wrist's broken. You could lose function in that wrist. You could damage the arteries and nerves. They understand alternatives. If you don't want us to call an ambulance for you, you can drive yourself. And then they need to sign that. If it's a minor, we need to talk to the parents and get a co-signature. If the parents aren't there, then Bill plus the patroller need to speak to the guardian. And if you can't contact the guardian, Bill will take care of this through law enforcement. Review the protocol on helicopter operations on your own. And the telephone and radio reference are for your use. Call my cell phone if you have any questions, and use the emergency department medical control as needed. Okay, go ahead and complete the knowledge assessment on that area.